CEN Written Exams Questions. Question 1. A patient with subarachnoid hemorrhage presents with a sudden thunderclap headache, nuchal rigidity, and photophobia. Which diagnostic test is the initial gold standard? Option A, non-contrast CT head. Option B, lumbar puncture. Option C, MRI brain. Option D, CT angiography. The correct answer is option A. Non-contrast CT head. Non-contrast CT head is the initial test for suspected subarachnoid hemorrhage, SAH. It has a sensitivity of 90 to 95% within 24 hours of onset. If the CT is negative but clinical suspicion remains high, a lumbar puncture is needed to detect xanthochromia, indicating breakdown of red blood cells in the CSF. CTA may be done to identify the source of bleeding, but CT is the initial diagnostic test. Question 2. A patient with a corneal abrasion should receive which treatment? Option A, antibiotic eye drops. Option B, NSAID eye drops. Option C, cycloplegic agents. Option D, all of the above. The correct answer is option D, all of the above. Corneal abrasion, scratch on the cornea, is treated with topical antibiotics, to prevent infection, NSAIDs, for pain, and cycloplegic agents, to reduce ciliary spasm and pain. A patch may be used for comfort but is not always recommended. A slit lamp examination with fluorescein staining confirms the diagnosis and rules out a foreign body or ulceration. Question 3. A patient with suspected carbon monoxide poisoning has a headache, nausea, and confusion. The CEN should: Option A, administer high-flow oxygen via a non-rebreather mask. Option B, obtain a CT head. Option C, administer activated charcoal. Option D, obtain a carboxyhemoglobin level. The correct answer is option D, obtain a carboxyhemoglobin level. CO poisoning presents with headache, nausea, confusion, and cherry red skin, late sign. The diagnosis is confirmed with a carboxyhemoglobin, COHB, level. Treatment includes high-flow oxygen, non-rebreather mask. Hyperbaric oxygen therapy may be indicated for severe cases, COHB 25%, cardiac ischemia, neurologic symptoms, or loss of consciousness. CT is for head trauma, charcoal is not indicated for CO poisoning. Question 4. A patient with a nasal fracture presents with epistaxis. The CEN should: Option A, have the patient pinch the nose and lean forward. Option B, have the patient lean back to prevent bleeding. Option C, insert a nasal packing. Option D, apply a cold compress. The correct answer is option A, have the patient pinch the nose and lean forward. The first step for anterior epistaxis, nosebleed, is to have the patient pinch the nose, applying direct pressure, and lean forward to prevent blood from flowing down the throat and causing aspiration or nausea. If this fails, nasal packing, anterior or posterior, may be needed. Cold compress may be used as an adjunct. Posterior epistaxis is a more serious presentation that may require ENT consultation. Question 5. A patient with a suspected stroke has a blood pressure of 190/105 mmHg. The CEN should: Option A, administer 4-labetalol to lower blood pressure. Option B, permit hypertension unless the patient is receiving TPA. Option C, administer sublingual nifedipine. Option D, start a nitroprusside drip. The correct answer is option B, permit hypertension unless the patient is receiving TPA. In acute ischemic stroke, hypertension is often permissive to maintain cerebral perfusion pressure, CPP, in the ischemic penumbra. Routine blood pressure lowering is not recommended unless the patient is a candidate for TPA, in which case BP should be lowered to 185/110 mmHg before TPA administration. After TPA, BP should be maintained 180/105 mmHg. Question 6. A patient with heart failure presents with severe dyspnea, pink frothy sputum, and rales auscultated halfway up the lung fields. The CEN should anticipate which intervention? Option A for normal saline bolus. Option B for furosemide and nitroglycerin. Option C for epinephrine. Option D immediate intubation. The correct answer is option B. For furosemide and nitroglycerin. This patient is in acute decompensated heart failure with pulmonary edema. Management includes diuresis, furosemide, and afterload reduction, nitroglycerin, to reduce preload and afterload. Oxygen and non-invasive positive pressure ventilation, BiPAP/CPAP, may also be used. Normal saline would worsen volume overload. Intubation may be needed if the patient fails non-invasive measures. Question 7. Which sign is most suggestive of a factitious disorder, Munchausen syndrome? Option A. Inconsistencies in the patient's history and symptoms. Option B. A history of multiple hospitalizations. Option C. Unexplained physical findings. Option D. All of the above. The correct answer is option D. All of the above. Factitious disorder is characterized by the patient feigning or inducing symptoms for secondary gain, attention, care. It presents with inconsistencies in history, multiple hospitalizations, and unexplained physical findings. Unlike malingering, there is no external gain. Careful history, documentation, and consultation with psychiatry are recommended. Question 8. A patient is suspected of being a victim of human trafficking. The CEN should: Option A. Notify security and social work. Option B. Notify law enforcement. Option C. Provide a private space for assessment. Option D. All of the above. The correct answer is option D. All of the above. Human trafficking is a serious crime. The CEN should recognize signs and screen patients for trafficking. The patient should be assessed in a private space away from their companion, who may be the trafficker. Security and social work should be notified. Law enforcement should be notified if there is suspicion. The patient's safety and privacy are essential. Question 9. Which medication is indicated for status epilepticus as a first-line agent? Option A. Lorazepam, Ativan, 4 mg 4. Option B. Fosphenytoin 20 mg/kg 4. Option C. Levetiracetam, Keppra, 1 gram 4. Option D. Valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Benzodiazepines are the first-line treatment for status epilepticus. Lorazepam 4 mg 4, or diazepam 10 mg 4, is the preferred agent. If the seizure continues, second-line agents include fosphenytoin, valproic acid, or levetiracetam. Airway management and ABCs are priorities. Early treatment reduces morbidity and mortality. Question 10. A patient who is a minor, under 18, is brought to the ED with a life-threatening condition. The parents cannot be reached. The CEN should: Option A. Wait until the parents are reached. Option B. Provide life-saving treatment under implied consent. Option C. Call Child Protective Services. Option D. Transfer the patient to another hospital. The correct answer is option B. Provide life-saving treatment under implied consent. In emergencies, implied consent allows healthcare providers to treat a minor without parental consent when the patient's life or limb is in danger and a delay could cause harm. The CEN should also notify the parents and CPS as required. This is part of the EMTALA requirements. Question 11. A patient presents with a chemical splash to the eye. The CEN should: Option A. Neutralize the chemical with a buffer. Option B. Irrigate the eye continuously until pH is neutral. Option C. Patch the eye and refer to ophthalmology. Option D. Administer antibiotics. The correct answer is option B. Irrigate the eye continuously until pH is neutral. Chemical eye injuries require immediate and continuous irrigation with normal saline or lactated Ringer's solution until the pH of the eye is neutral, pH 7.0. Alkali burns are more damaging than acid burns and require extended irrigation. Irrigation should begin immediately and continue for at least 15 to 30 minutes. For severe alkali burns, it may take hours. Antibiotics and patching may be used after irrigation. Question 12. A patient has a left-sided stroke. The CEN should anticipate. Option A. Right-sided weakness and expressive aphasia. Option B. Left-sided weakness and neglect. Option C. Right-sided weakness and impulsivity. Option D. Left-sided weakness and aphasia. The correct answer is option A. Right-sided weakness and expressive aphasia. A left-sided, dominant hemisphere, stroke typically results in right-sided hemiparesis and aphasia, expressive or receptive. A right-sided stroke causes left-sided weakness and neglect, ignoring the left side of the body and environment. This knowledge helps prioritize interventions, including swallowing assessment, dysphagia, speech therapy, and fall prevention. Question 13. A patient with a known abdominal aortic aneurysm, AAA, presents with acute, severe back and abdominal pain. The CEN should. Option A. Obtain a CT with contrast. Option B. Prepare for emergency surgery. Option C. Administer 4 fluids for hypotension. Option D. All of the above. The correct answer is option D. All of the above. This patient has a ruptured AAA until proven otherwise. The priority is surgical consultation and preparation for emergency repair. CT may be done to confirm but should not delay surgery. 4 fluids should be given cautiously, permissive hypotension, to avoid increasing bleeding. This is a time-critical surgical emergency. Question 14. A patient presents with a snakebite on the hand. Which intervention is appropriate? Option A. Apply a tourniquet. Option B. Suction the wound. Option C. Apply a splint and elevate the extremity. Option D. Administer antivenom. The correct answer is option D. Administer antivenom. Antivenom is the definitive treatment for snake envenomation. A tourniquet and suction are not recommended, they can cause tissue damage. Splinting and elevation are supportive but are not the primary treatment. Antivenom must be given as soon as possible, with monitoring for anaphylaxis. Question 15. A patient with a migraine presents with a unilateral throbbing headache, nausea, photophobia, and phonophobia. What is the first-line treatment? Option A. Triptan, sumatriptan. Option B. Acetaminophen. Option C. Morphine. Option D. Metoclopramide. The correct answer is option A. Triptan, sumatriptan. Triptans, 5-HT1B/1D receptor agonists, are first-line agents for acute migraine, especially when the patient presents early. They are effective at aborting the headache. Acetaminophen and NSAIDs are for mild headaches. Metoclopramide is an antiemetic that may be given as an adjunct for nausea. Morphine is not recommended for migraine due to poor efficacy and risk of medication overuse headache. Question 16. What is the initial fluid of choice for a patient with hypovolemic shock? Option A. Lactated Ringer's solution. Option B. Normal saline, 0.9% NaCl. Option C. Dextrose 5% in water, D5W. Option D. Blood products. The correct answer is option B. Normal saline, 0.9% NaCl. Normal saline, 0.9% NaCl, is the initial fluid of choice for hypovolemic shock, hemorrhage, trauma, etc. It is isotonic and rapidly expands intravascular volume. Lactated Ringer's is also acceptable but should be avoided in liver failure. D5W is not appropriate for volume resuscitation, it distributes into total body water. Blood products may be needed, but crystalloids are the first line. Question 17. A patient with cyanide poisoning, from smoke inhalation, presents with confusion, dyspnea, and a normal SpO2. The CEN should anticipate. Option A, sodium thiosulfate and hydroxycobalamin. Option B, oxygen only. Option C, naloxone. Option D, atropine. The correct answer is option A. Sodium thiosulfate and hydroxycobalamin. Cyanide poisoning often occurs with smoke inhalation. Symptoms include confusion, dyspnea, seizures, and lactic acidosis. SpO2 may be normal because oxygen is not utilized by the tissues. Hydroxycobalamin, vitamin B12A, is the first-line antidote, binds cyanide to form cyanocobalamin. Sodium thiosulfate is a second-line agent. Oxygen is supportive. Question 18. A patient presents with severe crushing chest pain. The ECG shows ST segment depression and T-wave inversion in leads 2, 3, and AVF. This is most consistent with Option A, anterolateral STEMI. Option B, inferior STEMI. Option C, non-ST elevation myocardial infarction, NSTEMI. Option D, pericarditis. The correct answer is option C. Non-ST elevation myocardial infarction, NSTEMI. ST segment depression and T-wave inversion without ST elevation indicate NSTEMI, or unstable angina. Inferior leads, 2, 3, AVF, show ischemic changes. NSTEMI management includes antiplatelet therapy, aspirin, ticagrelor, anticoagulation, and possible PCI depending on risk stratification, Grace score. STEMI requires emergent reperfusion, while NSTEMI is managed with a more nuanced approach. Question 19. A patient presents with a severe headache, fever, nuchal rigidity, and altered mental status. Which diagnosis should the CEN suspect? Option A, migraine. Option B, meningitis. Option C, subarachnoid hemorrhage. Option D, temporal arteritis. The correct answer is option B. Meningitis. The classic triad for meningitis is headache, fever, and nuchal rigidity, neck stiffness, often accompanied by altered mental status, photophobia, and vomiting. Prompt antibiotics, within 60 minutes of suspicion, are critical. LP confirms the diagnosis. The patient should be placed on droplet precautions initially. Empirical antibiotics include vancomycin, ceftriaxone, and ampicillin. Question 20. Which finding in a patient with asthma exacerbation indicates life-threatening status asthmaticus? Option A, wheezing. Option B, silent chest. Option C, peak expiratory flow rate, PEFR, 70% predicted. Option D, cough. The correct answer is option B. Silent chest. A silent chest on auscultation in a patient with severe asthma indicates minimal air movement and impending respiratory failure. This is a life-threatening sign requiring immediate intubation and mechanical ventilation. Other indicators include confusion, exhaustion, PEFR 33% of predicted, and SpO2 90%. Question 21. A patient with COPD presents with severe dyspnea, confusion, and cyanosis. ABG shows pH 7.25, PaCO2 65 mmHg, PaO2 55 mmHg. The CEN should anticipate. Option A, non-invasive positive pressure ventilation, BiPAP. Option B, high-flow oxygen via non-rebreather mask. Option C, bronchodilators only. Option D, immediate intubation. The correct answer is option A. Non-invasive positive pressure ventilation, BiPAP. This patient is in acute respiratory failure with hypercapnia and acidosis. BiPAP is the first-line intervention for COPD exacerbations with respiratory acidosis, as it can reduce the need for intubation. High-flow oxygen should be used cautiously in COPD patients to avoid suppressing the hypoxic drive. Bronchodilators should be given, but BiPAP is the priority for this acidotic patient. Question 22. A patient with testicular pain, nausea, and vomiting has a tender, swollen testicle that is elevated. Which diagnosis is most likely? Option A, epididymitis. Option B, testicular torsion. Option C, orchitis. Option D, hydrocele. The correct answer is option B. Testicular torsion. Testicular torsion is a time-critical emergency requiring prompt surgical intervention to salvage the testicle. It presents with sudden, severe testicular pain, nausea, vomiting, and an elevated, tender testicle. Doppler ultrasound is the diagnostic test, though surgery may be indicated without imaging if suspicion is high. Torsion is a surgical emergency. The window for salvage is typically 4 to 6 hours. Question 23. Which concept is part of the Just Culture framework in nursing? Option A, balancing accountability and safety with a non-punitive approach to errors. Option B, blaming the nurse for errors. Option C, punishing all errors. Option D, avoiding reporting errors. The correct answer is option A. Balancing accountability and safety with a non-punitive approach to errors. Just Culture is a framework that balances accountability and safety, promoting a non-punitive approach to reporting errors. It distinguishes between human error, at-risk behavior, and reckless behavior. The goal is to improve patient safety by encouraging reporting and learning from errors without fear of punishment. It is the foundation of a safety culture. Question 24. A patient with a history of HIV/AIDS presents with a fever and dyspnea. The CEN should suspect. Option A, pneumocystis jirovecii pneumonia, PCP. Option B, tuberculosis. Option C, bacterial pneumonia. Option D. All of the above. The correct answer is option D. All of the above. Patients with HIV/AIDS are immunocompromised and susceptible to a range of opportunistic infections. PCP, pneumocystis jirovecii pneumonia, is a common cause of pneumonia in HIV patients. Tuberculosis and bacterial pneumonia are also possible. The CEN should implement appropriate isolation precautions, airborne for TB, droplet for others, while evaluating the cause. Question 25. A patient with Guillain-Barré syndrome is admitted with rapidly progressing weakness. The CEN should monitor for Option A, hyperthermia. Option B, respiratory failure. Option C, hypertension. Option D, tachycardia. The correct answer is option B. Respiratory failure. Guillain-Barré syndrome is an acute demyelinating polyneuropathy that causes ascending weakness. The most serious complication is respiratory failure due to respiratory muscle weakness, diaphragm and intercostals. CENs should monitor vital capacity, negative inspiratory force, NIF, and tidal volume. Intubation may be necessary if vital capacity drops, 15 ml/kg, or NIF decreases, -20 cm H2O.